Welcome to What's the Chai with Angie on a quest to make healthcare leadership feel human, accessible, and real. Three gentle Zoomcast nudges before we start. Please introduce yourself on chat. Stay on mute until the audience Q&A at the end. We want your questions. Please type them into the chat and I'll ask them at the very end. We're here to discuss our personal journey and perspectives. We're not here sharing our titles or day jobs, so please reach out offline for those elements. It will not be addressed in this forum. With that, let's get started. I am so excited to be here today talking to Hellen. Hellen, you know this. I started this series because really very early in my career, I did not see myself reflected in leadership, often felt like I was figuring things out on my own. Mentors, leaders, friends like you made me feel like there are so many powerful stories in healthcare that just don't get told. So, this space is about changing that. Each conversation is meant to feel like everybody is sitting down with you and I at our dining table, having chai, talking about our real journey, the highs, the lows, and everything in between. So, it's just a chat, and we've talked about that for our audience. This is not rehearsed, there's no practiced answers. Hellen truly does not even know what questions I'm going to ask her. So, this is exciting for me and probably nerve-wracking for her, but we'll get, to talk about it. I'm so thrilled for the audience to meet you, Hellen. Dr. Oduor is an accomplished physician, an NIH fellow, published author, and a healthcare executive. What I appreciate the most about you is your humility and candor in the midst of it all, reinventing and pivoting so many times. So, Hellen, welcome to What's the Chai? If you wouldn't mind telling our audience about your journey and how do you pivot so fluidly?
Oh my God. Well, first of all, thank you so much, Angela. Thank you. I remember you and I talking about having some kind of platform. I'm not quite sure when the seeds were first planted for this platform, but I feel like years ago, you and I talked about this, and it's so exciting to see it come to fruition. So I'm very honored to have you invite me to share my journey and my perspectives today. So thank you so much for having me. And I really applaud your leadership style and leadership journey. You've always been a leader that I admire because I feel like you kind of chart your own path. And the reason your leadership style resonates with mine, because I consider you a non-traditional leader, and you're always a trailblazer. So once again, thank you for having me. So for those in the audience that we haven't met, as Angie introduced me, I am Dr. Hellen Oduor, and I wear many hats. As she said, I am a physician. I'm also a healthcare professional, something I've done for close to 20 years now. And I started my journey as a doctor. That was my very first introduction to healthcare. And after med school, I was working in Kenya, which is my country of origin. I was born and raised in Kenya, and I worked for the federal government at the time. So the healthcare system in Kenya is very different from what we know it here. So once you graduate from medical school, you have the opportunity to elect where you want to work as long as you're working with the government.
Okay.
So I chose to work in a resource limited setting at the time. And since most people did not want to work in a resource limited setting, if that's what you selected, most likely that's what you got. So that's what happened to me. So I ended up being deployed in an area of the country that I hadn't been to. And it was very different because the medical school was in the heart of the city in Nairobi, where you're the capital of the city, you have all the resources, very urban, very lively part of the country.
Yeah.
And then here I am as an intern moving to a part of the country that I had never been to. And to make it more challenging, I did not speak the language in the
Mhm.
area where I was going to work. So I worked there for a few years, finished my internship. I decided to stay on after internship. I ended up fully immersing into the culture, learned the language. I felt like I was one of them. I really appreciated their culture. I stayed on, and then very early in my career, the government, again, it was a federal posting. So I was appointed as the chief medical officer. And I was working in one of the districts, and the district had about 9 hospitals. So once again, you're a young medical doctor deployed by the government, a part of the country you have never been to, very resource limited. When I say resource limited, I mean I did not have any tapped water for the entire time I was there. So I don't know if you're familiar with a borehole or a well, but that's where you put the
Yeah.
bucket in and kind of
Yep.
pull the water
Yep.
up. So that's what we did. That's how I got the water for showering, for doing my laundry, and only bought water to drink. Then I got the opportunity to be CMO, which again, very different healthcare system. So when you're in administrative roles in the healthcare system at the time, you still had to continue practicing as a physician. So I would see patients in the clinic, I would be in the OR doing surgery, I would be delivering babies, but at the same time managing the hospital, worrying about the budget, about resources, about staffing, being pulled between cases that the generator is not working. So with that kind of exposure, I was wearing so many hats, and I really enjoyed what I was doing. And with that kind of exposure, I really got to see beyond each individual patient. So I started seeing what's broken in the system, and just starting asking myself, what can I do beyond treating one patient? Having one patient encounter to me just felt like it was not enough. So that's where the seeds first got planted, and I knew that there was a broken system and I wanted to be part of that solution. Fast forward to a few years later, I made the bold choice of immigrating from a country where I was born and raised, the only country I'd ever lived in, and I moved to the US. And the only thing I had then was myself, my husband, and both our families, and we decided to just venture. There was no rhyme or reason for coming to the US. We could have gone to a different country, but we chose to come to the state of Texas. And at that time,
Glad you did.
yes, came to the state of Texas, and there were a few kind of transitions there. Just with the name of this platform being chai, the definition of chai completely changed for me when I came to Texas. I'm used to having my chai hot, and then I come to Texas, I'm like, you don't have milk in your chai, and now you're putting ice in it. Anyway, lots of transitions there. But then, as I was thinking about what was next for my career, I was faced with the decision of should I go back to residency, and at that time my interests were either cardiology or general surgery. I really enjoyed being in the OR. There's something about being in the OR. Those moments really kept me grounded, and some of the lessons I learned in life were really learned in the OR. So while I was making that decision, I decided to go ahead and pursue my board exams, which I successfully passed. And then came the residency matching the first year, and I did not match. And that was a very pivotal point for me, because up to that point I was pretty successful. So it was the first time I was hearing a strong no, and I asked why, and at the time they said, well, in the US most of our students graduate and within a month or two they're getting into residency. You, on the other hand, you have a gap. And I'm like, what do you mean a gap? Do you know what I was doing with myself during that perceived gap?
Yeah.
So anyway, so fast forward, I kind of decided, this is kind of one of those moments where when life gives you, lemons, and you decide what to do with it. So I had the option of staying on another year, staying home, wondering what to do. So I made the decision to go back to school and study public health. Again, back to that population focus that had kind of the seeds had been planted. And I went back to school. I studied epidemiology and biostatistics. And then while I was there, I got very interested in research. So everything was pulling me towards a population and systems thinking rather than just individual patient care. Then one time, I was looking through just the National Institutes of Health, which is one of the largest medical research centers in the world. And I saw a profile of one of the researchers, a physician who I was very interested in, because she was studying sickle cell disease, which is a disease that's very close to my heart. And in my previous clinical work, I was treating a lot of patients with sickle cell disease. So I reached out to her, just a cold call, didn't know anybody. And I said, hey, I would like to come work with you in your lab. And she responded and she said, yes, when are you ready to start? You can come and do a research fellowship at the NIH. And I was very floored because there was no connection, no network. I just reached out to her directly. And at the same time, I also had an opportunity to work with the World Health Organization and the CDC. So now I had a great problem to have. I had three wonderful organizations that had said yes to me at a time when I had been told no, and that had really I'd taken that no pretty hard when I could not get into residency the first time. But then I kind of got motivated and said, even though I was told no and one door was closed, now I have three that are open and I get to choose. So fast forward to that, I said yes to NIH. I went there, did my research fellowship. I was treating patients with sickle cell disease. We were doing stem cell research on patients with thalassemia as well. And I got my first publication, and that really motivated me. And at that point, it was solidified for me that I can continue to make a difference in patients' lives, even if I don't have that stethoscope around my neck and I'm not listening to somebody's heart or treating individual patients. So that was very pivotal for me. So I moved to Maryland during that time. And then once I was done with the fellowship, I came back to Texas, and I guess the rest is history, Angie.
You know, it's interesting. You've shared your journey with me, and thank you for doing that. And even though we've been friends for years and you've shared parts of your story, I'm hearing other parts of your story today for the first time. So I wanted to share a couple of thoughts and then I'll follow one of the threads out. It's interesting. We hear this phrase, when life gives you lemons, make lemonade, right? But I feel like what you really did is life gave you lemons and you ended up making this fancy iced lemon cake, which I love that recently. So, it's like your transition on that is really interesting. I also think, there are things that you have done. I'm not sure you've even paused and recognized, and I'm going to call it out for folks that are listening now or in the future, right? You are somebody I feel does not really see closed doors or walls in front of you. Things come up and you kind of just go, okay, not here, let me figure out another way. And you just kind of keep going, right? Whether it was the residency now in the US, whether it was, I mean, a lot of folks don't really do cold calls, Helen, even in the normal space. And so for you to do a cold call to somebody that you saw writing a paper on or doing research on something is pretty darned interesting and very inspiring for folks that are, facing walls currently. So just wanted to say kudos on those things. The other thing I think is a very something you and I've connected on is the value of education, right? So you already were trained as a physician, you were a practicing physician, you were a CMO, you came here, and then when you hit one of those walls, you said, I'm going to go study, and you didn't just go study something, anything. You went into epidemiology, which for anyone that's not in healthcare, that's not a easy peasy like graduate program to go through. So I think the value of education is something that I feel like you're somebody that highlights and really values it. Let's dig a little deeper and kind of go through maybe some of those early struggles, but
Mhm,
talking about who you are and what that made you, right? So you realized that your path wasn't going to be straightforward, and
mhm.
you decided to go down different pathways. What was a moment in your career that felt lonely but changed you in those early days when you were trying to pivot in the US from thinking like a practicing physician to, okay, now I'm going to be more systems thinking and looking at research and clinical or, systems practice?
Mhm. So I'm just going to rephrase your question, Angie, to make sure I understand. So you're asking about moments that kind of felt lonely, but at the same time change my outlook. And
Yes, something
okay.
that changed your outlook, your practice. Maybe lonely is a fairly strong word. So if
It
you
is
felt
true.
different or just, was like a pivoting moment where you said, okay, I'm going to approach life a different way or leadership a different way, what was that moment?
Yeah, honestly, I think that moment was that initial application to residency. And I think I alluded to it earlier because, you go to medical school, and a lot of us are introduced to healthcare through a very narrow lens.
Hmm.
You go to medical school, you become a doctor. You go to nursing school, become a nurse, become a pharmacist, become a researcher, medical scientist. So once you graduate, you almost have a very linear path just based on how you were introduced to healthcare. You don't see it any other way. And my mom is a nurse. So I grew up in a household where my mom was the chief nursing officer. And at the time, I didn't even realize it. But I grew up looking at that kind of one lens
Yeah.
path where it's a very linear path, and you do this, then next you do this, and next you do this.
Yeah.
So up until that time, I would say my last few years when I was practicing at the bedside and at the same time being the chief medical officer and office administrator, I think that is the first time it ever occurred to me that healthcare doesn't have to be that traditional linear path.
Yeah,
So when I came to the US, at that time I didn't really have clarity. I knew I wanted something different and I wasn't sure. So when I tried the linear path of, okay, go back, do your residency, which was very daunting. You've already completed your residency, you're already a practice and licensed practitioner, and now you have to go back and redo your residency. So that first time when I did not successfully match was I took that rejection quite hard. I think that's one of the moments that really felt really lonely because then you're existing in this third space where you are
yeah,
trained as a
yeah,
clinician, you're in a new country, um, you didn't grow up here, you didn't go to medical school here. So there's a lot of othering and a lot of layers that are added to you.
yeah,
And that moment just felt very lonely because I didn't have a lot of people. I didn't have a community of people that were going through the same thing as I was.
yeah,
Anybody else who was studying for boards at the same time had gone to medical school in the US. So they couldn't really relate to my story.
yeah,
So those moments felt really lonely. I had a lot of support from my family. My husband was the biggest support during that time, but he's not a doctor. He wasn't going through the same journey. So I think after that time, I did take some time. It, kind of took a toll on me, but I just told myself going forward, I will not allow myself to feel that way again. And I kind of gave myself permission to go through my emotions. And then I just got up. I had a plan. I like journaling, so I write things down and I wrote down and I said, okay, this is what has happened, but this is what I'm going to do to fix it going forward. And at the time, I didn't know what fix it means.
yeah,
So after that time, I've just learned to be very resilient. I think that moment really shaped my resiliency and just how to move on forward. And I told myself that just because I wasn't successful in one path doesn't mean it's not a zero sum game.
yeah,
It doesn't mean that I'm not a successful healthcare professional at all because of that one moment. So that is the decision that I made. And I made a very conscious and intentional decision going forward that I was not going to allow myself to be in a situation where somebody else dictated my value or where one decision meant a door is shut. What I just said is, okay, I'll just create a different door and create a different path. So I sort of became a trailblazer in that path. And subsequently, I had other foreign medical graduates reach out to me and say, hey, wow, how did you do this? And I'm
yeah,
like, I wish you knew the story.
yeah.
So I think that was the big one. Of course, I've had other moments, but that's probably the biggest. And
I,
the defining moment for me was resilience was going to be one of my very core values. And it's something
yeah.
that I continue. And I'm very tenacious. So tenacity and resilience were the two core values that I developed out of that
I
experience.
love what you said, Helen, because a lot of us have hit that wall at some point, right?
Mhm.
Um, and it's different things that trigger it for us. But we all have had a moment where we sit down and we are like, oh, crud, what do I do? What did I do? Why am I here? And where do I go from here? And how do we move past that is honestly, one of the core reasons why the seed for this conversation ever came about. Because and this is where I'm going to pivot and have you talk a little bit more. So when I look at my story and my journey, right? You and I have talked about this. There was a moment for me similarly when I was very early in my career where I had just moved actually to Dallas and was really excited about the path I was on. And then there came a situation where I was put in a position of taking the blame for something that was not mine. And I sat down and I was like, it feels lonely. Nobody's there around me. Everybody is like, all my tribe is global, or back in Baltimore where I did grad school, and really needed to think about, where do I go from here? And one of the things that became kind of to your point, resiliency and tenacity are core values for us. But what actions do we take to move us forward? Who are the tribe or the mentors that guide us forward? What unwritten rules are you learning on the way as you move forward? Those are some of the things that I really feel are things that we don't talk about enough in healthcare, in leadership specifically. So I'm going to have you move a little bit into talking about leadership and kind of that journey moving forward for you, right? So tell me about your personal board of directors or the mentors that poured into you along the way. Talk to me about maybe one or two of the unwritten rules that you had to learn along the way in your pivots, whether it was doing that cold call to the person that did, or pivoting into quality and safety, and then into operations, because you experienced operations in a very different way while you were the chief medical officer, internationally. And then now in healthcare in Texas, you're experiencing it in a very different way. So talk to me a little bit about the people as well as the rules that you uncovered.
Yeah, so I think that the rules that I uncovered is, I mean, very blatantly, like nobody's coming to save you, Angie. I realize that, you have to take ownership. You can choose how you react to a situation and decide to, just kind of mop about it and woe is me and ruminate in whatever type of situation you find yourself in, or you can decide to take ownership. So anytime I'm in a situation where an outcome is less than favorable or not what I hoped for, then I always take ownership and I'm a big writer. So I always write down my thoughts and I write down the things that are either that I contributed to and what part do I own and what are the things that are outside of my control. So I kind of look at this sphere of influence. What's within my sphere of influence? What is it that I'm able to control? And those are the things that I focus on. So I quickly learned that just having this woe is me mentality is not going to take you anywhere. And I also learned in a very kind of hard way that quiet excellence really doesn't take you anywhere.
Mm.
If you don't, if you're quietly, competently working behind the scenes, nobody's going to see that,
Yep.
Angela. Like it took me a while to realize that. And it's one of the things you think you know, but it's an unsaid truth in healthcare, maybe even in the other industries, I don't know. So people, they know that you're a top performer, they know that you do good work, but what you don't realize it that you're actually expected to articulate that
Mhm.
and take charge of your own journey and articulate your value before somebody else articulates it or defines it for you. So that's one of the big lessons that I learned. And one of the things that a mentor shared with me was just making sure that you're always prepared and the opportunities will come. And it's not always true. They may not come at the time that you're looking for, but just making sure that you'd rather be prepared and not have the opportunity than vice versa, where there's an opportunity, you're not prepared. And everybody's definition of preparation looks different, whatever that may be in whatever leadership career, but just making sure that you're prepared. And then the self advocacy is one that I really underestimated because I grew up just with very kind of humble leadership, always being taught about the importance of humility, but to an extent, it can be self-limiting. So just balancing the self-advocacy and humility is kind of like a fine dance that I had to learn, and I'm still learning.
Yep.
And I think one of the things that one of the mentors told me, which she's had a huge part to play in my career. And if I was to have that informal board of career or board of directors, like you said, she was probably the head of the board of directors. She was very candid with me. The days when I made mistakes, she called me out and said, "You made a mistake. You fumbled that ball here, Helen." And she's also the one who pushed me to articulate my value. And why are you not speaking up? And she said, if you're going to be at the table and not speak up, then just give up your seat at the table. So
Mhm.
just having this tough love type of mentorship really worked well for me. And she really, really taught me how to self advocate, but at the same time, staying humble. So I would say that was the biggest influence for me, and just having the right mentors. And then some of the mentors really came from unexpected places. And going back to my initial journeys as a doctor, you go in there and the healthcare system is very different. And I quickly learned that i'm I'm going to learn the most from my career from nursing. So it's not about hierarchy. So I quickly identified who was the most experienced nurse. And she's the one who would, keep me on track when I'm moving too slow or I'm moving too fast, and teaching me how to start the IVs and starting those things. So she's somebody we still keep in touch all these years. And she served as a mentor regardless of what her title is, regardless of what that I in that setting, I outranked her, but that didn't matter. So just finding the mentors in the most unexpected places is also something that I found to be successful for me.
I love what you shared, and I'll pull out two pieces, and I actually want to see if our audience has any questions for you before we wrap up. But I'm a huge believer in advocacy. I also, like you, struggled on that path where it was very much about quiet excellence, and then realizing that you really need to speak up for yourself because that's what is the need of the hour in the space that we are practicing. The other piece on that is this concept that, titles are not leadership. Those are completely distinct realms.
Agree.
And mentorship and guidance and, kind of finding excellence amongst all levels of the organization across levels of experiences is something that I'm a huge advocate for. So I love hearing you talk about those two things. So let me pause. Do we have any questions from the audience? You can unmute and ask, or you can put it in chat. I'll give it 5 seconds. Okay.
I can ask a
Nobody's
question.
go
I
for
have a
it.
Oh,
question. This is amazing to hear, Helen. Thank you for sharing. I didn't know a lot of these things. I knew very little, so I'm glad I tuned in and listened to you. When you come from a different country and you have practiced and worked in a different healthcare environment, and you get a role which is in a leadership role in a different country, in a different space, do you ever feel like unprepared or like I don't really know this landscape well enough? And then how do you deal with getting to know it, learning about it, and performing well?
That's a
yeah,
great
thank you.
question.
Yeah, thank you. Thank you for that question, Approver. So, yes, to the short answer is yes. You'll always feel coming from a different environment, you'll always feel like it's new, you'll feel like you're unprepared. And that is normal. I think that's the part of it where he's humble enough to know your limitations. However, one of the things that a mistake that I made earlier on is in my career is having this analysis paralysis, overthinking things, waiting until I'm ready, waiting for everything, even the decision to have children, waiting for the perfect time. So this concept of everything in your life has to be perfect before you can perform can really be debilitating. So when you're coming from a different country, different setting, different environment, and you're in a leadership role in a different country, to me, I don't even look at it that way. Like, what does it matter that I come from a different country or I speak differently? Or like, those are layers that are not relevant to your ability to perform the job. So I think just having that self confidence that those are just parts of you that do not really matter when it comes to the job confidence. And Apuva, what really shaped me honestly as in my personal and professional career is realizing and accepting that I can be a masterpiece and a work in progress at the same time, and that is okay.
That is beautifully well said, Helen. I feel like I'm going to have a quote on my wall. You can be a masterpiece and a work in progress at the same time. I will also add to what Helen said and share that folks from anywhere globally, and even folks that grow up in the same country, whether it's in the US or any other country you pick, when we get into leadership positions, all of us have self-doubt. All of us have some shade of, and I'm actually going to start reading a book called Imposter Syndrome. And so part of being able to move past that is, I think Helen had great advice, but it's that concept that she shared, which is I can be a masterpiece and a work in progress. One of my mentors used to call it build the bridge as you're walking on it. And it's so hard to do. It is the hardest thing in the world. I know we have 1 minute, so I want to be mindful of everybody's time and be thankful of that as well. Helen, I'm going to have us wrap up with one piece of advice that you have for either your younger self or leaders in healthcare that are looking at you right now. And also share maybe a podcast or a book that you are reading right now that you can guide them on to help them grow in their reflections.
Yeah, sure. So I'll start with the book because it's something I was actually reading and I'm listening to it. I'm listening to a book. It's called The Ideal Team Player. And so I'm a big reader. Sometimes I read like a leadership book, sometimes just a book for fun. So currently reading The Ideal Team Player. And what triggered is I'm just trying to kind of support my team. I've had some dynamics in my team with new team members and tenured ones. So very interesting read, very quick read that I would highly recommend. And then I think one of my biggest takeaway is one of the books that I read, I think it's Steve Covey, if I remember correctly, is talking about trust. So the foundation of every relationship, whether in healthcare, in leadership, or in your personal space, is about trust. So making sure that you are a leader who is trustworthy, but also building those relationships where you have that level of trust, and that so things really move at the speed of trust. That's really the essence of Steve Covey's book, and it's something that I found to be true. So taking the time to build the trust and build the relationships, because relationships is an outcome that is not on any dashboard, but it will really, really go a long way in your leadership journey.
It almost ties into that phrase, culture eats strategy for breakfast, right? Culture is based on foundationally those relationships and the trust in those relationships. What a great takeaway. Thank you so much for spending your time with me today, Helen. I know it's a Saturday evening and you could have be doing so many things. Thank you for that. And thank you for those that joined us on the call. I appreciate everybody's time. The goal for today and every day for me and for Helen and each of you is to create spaces where healthcare leaders feel human, accessible, real, and seen. And I'm hoping that today's chat with Helen resonated with you. Share it with somebody who needs it. And I'll see you at the next Chai Chat on September 19th. Thank you.
Thank you so much, Angela.